Okay, hello. I should volunteer for Nadia's study because I certainly do experience some of the psychological side effects from the earthquake from 10 years ago. I'm Teddy Wuyo. I'm one of the neurologists here at Christchurch Hospital. I work mainly at Christchurch Hospital, but I also do research in conjunction with the team at NZBRI. My main interest in neurology is acute stroke and been involved in clinical trials that looked at an effective intervention for acute stroke. So today I'm just going to take you through the journey we went through in the last decade or so in one part of the acute stroke treatment in Clot Retrieval. So concept of stroke is actually quite simple. You have a clot blocking the blood vessel and stopping the blood supply to the brain. And because of that, there's a wider region of the brain that's under-perfused or ischemic without blood supply. And a small part of it is called the core. That's the brain that's already dead. No matter what you do to restore the blood flow, that part of the brain will not come back. But the wider area called the penumbra, which is a Latin word for shadow, is the brain that's at risk of dying, but not quite yet dead. But if you restore blood flow, that's the area of the brain that you can save and potentially reverse the problems stroke causes the patient. So this is a real patient. It's not projecting very well, but there's a big clot sitting on the right side of the brain. And this is a video that I've made from the perfusion scan, some of the concept that Tracy has talked about, looking at blood flow. And if you look at the video, concentrate on the right-hand side, hopefully you can see clearly that there's a delay in the blood flow to that side of the brain. And because of that, that's causing injury to the brain. So with time, general thinking is that the area of survivable brain reduces over time. So the core, the brain that's already dead, enlarges. On average, about 2 million neurons die per minute of ischemic insult. So if you don't get rid of the clot or save the penumbra, you end up with a large stroke, and the patient would end up being quite disabled, potentially dying from the stroke itself. This is an unfortunate real patient from here. You can see there's a large area of the brain that's delayed blood flow, normal brain scan initially, successful treatment, large stroke. And despite being in his early 40s and had a few months of rehab, he ended up being in the rest home. So very poor outcome. These types of strokes are the most deadly and most disabling. If left untreated, about 80% of patients will end up being either permanently disabled or even dying from the stroke itself. And we do have effective medications to treat strokes, but in these subset of strokes where there are big clots present, it's only really effective in a small proportion, maybe about 20 or 30% of the patients that get this medication to try and dissolve it. And the other thing is that you can only get this medication currently if you come to the hospital within 4.5 hours of the stroke starting. So it's quite limited as to what these treatment can do. This is where the clot retrieval procedure comes in. So it's a minimally invasive procedure done through an angiogram. So the operator literally put a wire through the blood vessel, take a few pictures, and put in a stent, mesh-like device through the clot, catches the clot, and pulls it out. And it sounds simple, but it took a very long time to perfect. So this is actually shown here, a real patient's clot. This is actually the first ever successful clot retrieval, a picture of the clot from the patient's brain to ever be done in New Zealand from 9 years ago. And it's a 2 centimetre clot in the major blood vessel of the brain. And this is the first patient in my young career that I've witnessed coming in paralysed and walking out within a few days of a major stroke. It's taken 2 decades of research to get to the point a few years ago. So 6 years ago in 2015 was a landmark year for us. There were 5 research trials around the world that were pretty much published at the same time, showing that if you get the patient's clot out in time, you can reverse the deficits that the patient's experiencing. So these are quite astounding results. 50% of the patients in the trials were either normal or have very minimal problems at 3 months from follow-up, reversing the debilitating effects of the stroke. And I'm pointing this study out not because it's an Australian-New Zealand study, But this study is the only study that used what the perfusion scan, so advanced blood flow scan, to select patients for this treatment. So the colour schemes here are quite simple. The green is penumbra. There's no red near, but if you see a bit of red, that's the core. Remember, the core is the brain that's already dead, and the green is the brain that's savable. So this was the only study that used this technique to select patients for treatment and was the most successful out of the five studies that were presented 6 years ago. Give you a real-life example. This is another young patient we had a couple of years ago. She came in, she blocked off the biggest blood vessel on the right side of the brain, the carotid artery. You can see she had a lot of green in the brain, so a lot of brain to be saved, but also a lot of brain to lose if you can't get the clot out. The arrow there on the right is pointing to where the clot is, and you can see on the angiogram there's no blood flow beyond the major vessel, the carotid artery, got a clot out, and amazingly on the MRI scan next day there was no stroke, none at all. Full recovery. She came in paralysed. I like showing this next picture because she was using her hand that was paralysed 2 hours before this picture was taken. So absolutely miraculous recovery. So Clot Retrieval up to a couple of years ago, we really only offered if you can have the procedure started within 6 hours, because that's the timing that these 5 studies did in 2015. So it is a bit of a race against time, you know, to get the scans done, get to the hospital and have all the operators ready to get the procedure started. And that's a challenge because, you know, the South Island is quite a geographically challenging place. You know, we have patients spread out throughout the rest of the coast, further south towards Invercargill and also up in Nelson. And to get the scans done and transport a patient to us, have the procedure started within 6 hours is really, really difficult. It can be done, but it's not easy. So this is where that advanced scanning technique, you know, the perfusion with the green and the red maps that we generate comes into play here. Because if the patient scan shows this beyond 6 hours, does it really matter whether it's 6 hours or not? Probably not, because it indicates that the brain's still alive and you can still save it. And because of the techniques we used in that Australian-New Zealand study, the overseas investigators then went on and did a couple more studies demonstrating that we can offer this treatment to patients up to 24 hours from the stroke onset. If you have a large clot, if you have brain that's still viable, and the results mimic that of those patients were treated early on. So 1 in 2 patients with a major stroke with brain that's still alive will be normal in 90 days. So that's quite amazing stuff. And that really opens up a large window of opportunity to treat patients all around the South Island. And we also have using advanced computer technique using telemedicine to assess patients. This is actually from Queenstown. Queenstown can do this as well, this sort of scan and get the patient flown over, have the clot removed, and very small stroke for patients that get treated. And real-life example, I like showing these. This is a patient from Invercargill, as far south as they're going to get, I think. She was quite bad. She came in unconscious. Okay, she couldn't breathe. She had to be intubated, have a breathing tube down, and be sedated, put under general anesthesia. She had a blockage in the basilar artery, which is the main artery in the back of the brain. You can see there's survivable brain, area in the back of the brain. She had the clot removed. You can see the blood flow restored, and that was done at 9 hours. Amazingly, she caught a commercial flight back home. Okay, so yeah. So every time I say I think that's the end of our research, there's more. Okay, this is the case still. So one of the things we're looking at here is, can we go beyond 24 hours? You know, so we are in Christchurch. We are collaborating with some international colleagues, looking at some of the patients. We use this advanced scanning technique and treat it beyond 24 hours to see whether it improves the outcome is as good as those done under 24 hours. We've published early results, but hopefully we'll have more data to show you in the next few months. And the other exciting trial we're involved in is, you know, because we so far have been using these techniques to to look at patients whose brain looks still viable. But what about the patients who have a lot of red, not much green? These patients have been excluded from the trials that I've shown you so far, and these patients have not been treated because the brain's already dead. There's probably no reason to do this. There's also a risk of causing harm if you treat some of these patients. And that may not be the case. This is a patient we enrolled into this international study that was run. It's being run from Texas in America. She came in. She's 82. There's a lot of changes on the CT scan, and this is the area of the brain that's already dead. Quite a large, sizable part of the brain on the right side. And she was in this trial and actually received clot removal, the blood restored. And she walked in to see me 3 months after her procedure. When I saw her scan, I didn't think she was going to get a good outcome despite having the therapy done. So this is really extending the boundaries of treatment that we have for patients here. So these are some of the exciting research we have. Hopefully it will enable more patients to receive the effective stroke intervention. Thank you.